As of 12:01 a.m., York Region will be entering a lockdown following both Peel and Toronto. I'm here at Vaughan Mills, where the lineup outside of the mall has been consistent for the entire weekend, with both people inside and outside of the region. Now, we also know COVID cases have remained consistent in both Peel and Toronto post-lockdown. So the question is, do they work? Experts say yes, but there are limitations.
At the moment, how things are going, it could be a good idea for a short term. I'm not too sure longevity-wise how it'll do. As you can see, there's a bunch of people out.
I work at a retail store, and I see a lot of people coming from different regions. So if we locked it down in November, maybe we would stop the spread of the virus.
Experts have been saying for months, crowds contribute to the spread of the virus. The public knows this as well, and yet that isn't stopping people from gathering outside Vaughan Mills. What may be confusing is while Peel and Toronto have been in lockdown for almost 3 weeks, the number of COVID cases are still high and remain steady.
What the lockdowns are achieving is that they are stopping or preventing exponential growth. Our hospitals are not overwhelmed. We're not up to 10 or 20,000 cases a day. Without interventions, COVID will grow exponentially.
Both Vaughan Mayor Maurizio Bevilacqua and Newmarket Mayor John Taylor didn't want the lockdown, but say they agree with the province's decision. York Region has consistently seen the third highest daily case counts in the province. Of those, Vaughan makes up the bulk of all cases, reporting 72 new cases yesterday.
I think it's a community spread, no question about that, people gathering.
Newmarket is on the lower end for the region, reporting just 3 new cases yesterday. Mayor Taylor says while it's frustrating his town is taking the hit of restrictions despite lower case counts than neighboring areas, he understands the reasoning.
You're also the one that's just over the border where everybody's going to come to shop and pour into, and your numbers are going to then go up, and maybe you get locked down next anyway.
Epidemiologist Colin Furness says we shouldn't expect to see cases drop significantly with lockdowns. He says while they may help stabilize cases, what's really needed is surveillance testing to help eliminate COVID.
It's not enough to have hospitals open and wait for people who can't breathe to show up. This is not control. This is not even management. That's just reacting. What we really need to do is go where we know there is risk. We know where there's occupational risk. We know where there's high-risk neighborhoods. We know demographically who's at risk. We need to, if necessary, in hotspots, go door to door and recruit people to do testing, maybe pay them, offer them groceries, isolation services.
Epidemiologist Colin Furness says that over the next couple of weeks, people should really avoid going into other regions with looser restrictions to get their holiday shopping done. As we know, crowds do increase the risk of spreading COVID-19. Now, there is good news today coming out of the province. For the second day in a row, recoveries exceed the number of new cases.